Hi, I'm Greg Felt, County Commissioner and Chairman of the Chaffee County Board of Health. A lot of people also know that in my earlier career, I worked for 35 years on the river as an outfitter and a guide. In my early years, back in the 80s, I did a lot of trips with what you might call youth at risk. Kids that have been in trouble with the law or were headed in that direction and were enrolled in programs, kind of diversion programs maybe, to help them course correct and to change their behavior and start working in a more positive direction. I'll tell you a little story. I remember a trip I was doing through Browns Canyon. Many of you have probably been down there before. And in the early part of the trip, I was having a heck of a time getting these kids to work in concert together as a paddle crew. As we went through Canyon Door Rapid at the upper end of the canyon, it was total chaos. Nobody was following directions. We were hitting rocks, taking on water. By the time we came out of the bottom of the rapid, kids were scared, they were yelling at each other, and it was just not a positive situation. We weren't working well as a team. So I said, all right, kids, tell you what, I can see that following my directions isn't really going to work. So the next rapid, we're going to use a different model. It's called consensus. And we're just going to run this rapid. Everyone just do what they think is best, and we'll see if we can find consensus on how to do this. And so we headed down through Zoom Flume Rapid, total chaos. We hit the pyramid rock in the middle because everyone was just doing whatever they thought was best and whatever resonated best with them. They were pretty shaken when we came out of that Zoom Flume Rapid. And as we headed downstream into the Boulder Garden, I said, well, that didn't work too well, did it? Maybe we should use democracy and let's all vote on what we think the best thing to do is. And so as we headed into the Boulder Garden, I said, okay, raise your hand if you want to go to the left. And a few people slowly raised their hands, and I said, okay, raise your hand if you want to go to the right. And as the people started to raise their hands, we hit our first rock. It wasn't an effective way to manage this kind of a situation either. When we got down below there to Big Drop Rapid, I said, okay, let's try a third system, and let's just see if it works. This is called following authority. And what we're going to do is one of us will be in charge of the boat. We can use democracy to pick who's in charge, but then once that person's in charge, we're going to do what they say or do our best to follow those directions. They voted me the captain, fortunately, and I gave the simple commands. We followed the directions. We were all working together as a team. We got through. Things felt a lot better. The outcome had improved considerably. Why am I bringing this up? I'm not talking about authoritarianism here, but I do want to point out the fact that I think people are making a tremendous amount of noise about some minor inconveniences or surrendering of individual freedoms when we are facing a really daunting challenge that would go a lot better for everyone concerned if we were able to work together as more of a team. And I think the outcomes that concern us more have less to do with whether or not we have to wear a mask when we go into a particular store, or whether we need to make some sacrifices in terms of our social calendar for a little while, and think more about those bigger outcomes of the positive ones, keeping our schools open, keeping our businesses open, and then trying to protect our community health, particularly our most vulnerable. Much has been made of that, but also of everybody, because what we're starting to see as we get more and more of a statistically valid sample on the outcomes of COVID-19, we're seeing more and more diversity of outcomes. And frankly, people who often appear to be in very good health, and frankly are in good health and very physically fit, are coming out the other side of a COVID infection, potentially damaged for life. So I know that there are plenty of people that we can point to who had a mild case and wasn't any bigger deal than the flu that we know of. But there are certainly plenty of other cases where people have been seriously compromised, and we really can't even say what the final outcomes are going to be. So in a situation like this, I feel like it is a valid instance where we have the ability to make sacrifices individually for the benefit of the group, of our society, which will ultimately, return to ourselves as well. We're all going to benefit from that. I think the bottom line is we really have to own where we are. Our sacrifices, our hard work as a community from March through October and actually through November kept us in the yellow, so to speak. And we were able to keep, once we got reopened in June, we were able to stay open and benefit from all the business that went on, get our schools open. We made good plans and we implemented them. We're not in the yellow anymore. Our situation, as Andrea has described, is declining. Our numbers are getting tougher and the state has moved us into the orange. So we have to fight for the health of our community, and we have to fight to get back into the yellow. And that's going to take everybody. Each individual decision that we make has a whole potential constellation of outcomes and impacts that are associated with it. And I'm as human as the next person and as vulnerable and susceptible to weakness as anybody else. And I know that feeling, we all know that feeling of, well, yeah, but I think I'm going to just do this. Every time we do that in the context of COVID, we are increasing the risk for our community, and especially at this point in history of the disease in our county. Our community outcome is going to be the cumulative expression of all these incremental decisions that we're making, that we've been making, and that we will be making over the next several weeks, particularly through the holiday season. What is challenging and frustrating, but I think is a real positive and really important to keep in mind, is that it is actually within our power to reduce the harm. And it is totally within our power to stop the virus. I mean, that's what a shutdown is, right? That's what the lockdown, so to speak, was all about. That we could stop the surge if we stopped or greatly reduced our social interactions. We don't want to go back to that. And I don't think we need to go back to that. In fact, the science is showing if we follow the mitigation measures that we've gone over so many times, we can actually stay out of that kind of situation, but achieve the desired outcomes. And so if we can simply own the implications of our individual behaviors, hold our friends and our family, people that we can be honest with, hold them accountable as well, we can achieve the same outcome as a shutdown. In other words, drastically reducing our social interactions and drastically reducing the transmission of the virus without the associated pain of a shutdown. It's truly within our capacity to do this as individuals and as a community. And I would simply ask that you consider making this your priority through the month of December into the new year. We take these extra steps, we make this sacrifice for the greater good and the quicker return to normalcy for our schools, for our businesses, for our families, and for our society. Thank you.